If you didn't have diabetes, would you take insulin? No. If you didn't have asthma, why would you take an inhaler? I think sometimes we forget that the word obesity isn't just talking about weight, it's talking about a human and a person living with the condition every day.
Is obesity really a failure of the individual, or is it something far more complex? A chronic disease shaped by biology, environment, psychology, and systems that we are only just beginning to understand.
We see that a lot, is that there's this elitist atmosphere around people that live in smaller bodies kind of going, well, I just make better choices and I'm just doing this. And it's like, well, actually, no, you're not. You've actually been dealt a different genetic makeup to me.
A story that says obesity is about discipline, about choices, about willpower. Eat less, move more, try harder. And if it still doesn't work, well, the conclusion seems obvious. But what if that story is wrong?
We don't choose where we live when we're children because it's just where you are living. It's kind of all these cards that we need to really acknowledge that there's a lot of things here that aren't people's choices. So we need to stop thinking that obesity is a choice, because it's not.
Obesity were simply about willpower. Millions of intelligent, motivated, resilient people wouldn't still be struggling.
I've spent most of my life telling myself I can't eat this, I can't do this. It's kind of like to be in a space where actually all of a sudden you're then going, I need to make sure that what I'm putting in my body is nutritionally great. It's not about restricting me anymore. It's about making sure my body can function properly. And I'm not great at that.
My guest today, Sarah Le Brocq. She is an obesity advocate, a science and policy leader, and the founder of All About Obesity CIC, an organization working to challenge stigma, reshape understanding, and drive meaningful change in how obesity is treated and perceived.
Why are you taking a prescription-only medicine for a condition you don't have just because you're trying to get in a dress for a wedding or going on holiday and looking better? It's kind of like, it's so bad that we are so image conscious in this world. That's what people are willing to do, that they're willing to put a medication in their body that they don't need purely for aesthetic reasons, and that concerns me.
Sarah, welcome to Diaries. There's a story we've been telling ourselves about obesity for decades. It's a simple story, comfortable, convenient, a story that says obesity is about discipline, about choices, about willpower. Eat less, move more, try harder. And if it still doesn't work, well, the conclusion seems obvious. But what if that story is wrong? Not slightly wrong, not incomplete, but fundamentally wrong. Because if obesity were simply about willpower, millions of intelligent, motivated, resilient people wouldn't still be struggling. Doctors wouldn't still be frustrated. And one of the most advanced healthcare systems in the world wouldn't still be trying to solve the same problem decades after decades. So the real question becomes, what are we missing? Is obesity really a failure of the individual? Or is it something far more complex? A chronic disease shaped by biology, environment, psychology, and systems that we are only just beginning to understand. And perhaps, even more importantly, what happens when the people who live with obesity are finally invited into the rooms where the science, policy, and healthcare decisions are being made? Because sometimes the most powerful insights doesn't come from a laboratory. It comes from lived experience. Which brings me to our today's guest. My guest today is someone who has dedicated her life to changing the conversation around obesity, not just through advocacy, but through bringing the voice of lived experience into science, policy, and healthcare systems. She is an obesity advocate, a science and policy leader, and the founder of All About Obesity CIC, an organization working to challenge stigma, reshape understanding, and drive meaningful change in how obesity is treated and perceived. But perhaps most importantly, she brings something that has been missing from this conversation for far too long: the human perspective. Today, we are going to talk about obesity in a way that most conversations never do. We'll explore the science, the stigma, the systems that shape care, but we'll also explore the human story behind it all. So please join me in welcoming my guest today, Sarah Le Brocq. Sarah, welcome to Drug Diaries.
Thank you so much for having me here. Very, very excited to be given this opportunity. So thank you. Really appreciate it. And I think you're right. Like, the human side of obesity gets kind of mixed up with stats and data and us being told we're a burden on the NHS or society. And actually,
Yes.
it's like, I think sometimes we forget that the word obesity isn't just talking about weight, it's talking about a human and a person living with the condition every day. So thank you for this opportunity to kind of do a bit more of a deep dive into the complexities around obesity and why we should be looking at it in a very different way than we are right now. So I appreciate that.
Absolutely spot on. I totally agree with you. And you know, Sarah, before we talk about science, policy, or healthcare systems, I think it's important to start with the human story. Because
Yeah.
for many people listening today, as you said, obesity is often discussed in statistics or clinical guidelines, but rarely through the lived experiences of the people actually navigating it every day.
Mm-hmm.
And I've always believed that some of the most important insights don't come from textbooks or policy papers. They come from people who have actually lived through the system.
Yeah.
So maybe the best place for us to start is simply with you. So, Sarah, if you were to rewind the story before titles, advocacy, who was Sarah Le Brocq and what shaped the person you are today?
It's a big question. I'm not sure we've got time to answer
Yeah,
that one.
of course.
But no, I think it is interesting. And I think the more I've learned about myself, through going through this journey, I realized kind of it did start from kind of when I was much younger. So I think back to, obviously, I think fundamentally it starts with you are dealt cards when you're born. So you have a genetic makeup of genetic predisposition that we don't know ultimately at this
Hmm.
point. You're born as a baby and you don't know what that looks like. But I think, you can look at your parents and you can look at other family members and you can kind of get an idea of kind of, some of the cards you might have been dealt. So for me, I was born into two parents that had struggled with their weight, I suppose, for most of their lives as well. And so we're kind of living with obesity. And so actually the fact that I then went on to live with obesity shouldn't really be a big surprise fundamentally. But I think and not everyone kind of puts the two and two together because we do think of it as being this lifestyle choice. And actually, well,
Yes.
surely I could have just made better choices. So I didn't necessarily need to live with obesity. So there's always been that mindset. And I think I had that myself as well. So as a child growing up, I was very much of normal body weight. I wouldn't have classed myself as being overweight or even living with obesity at any point, really. I just noticed that I was very much curvier than my friends,
Hmm.
is probably the best way to describe it. So, I developed at primary school, I started kind of like going through puberty, so quite young, and then kind of developed kind of my boobs and hips quite young. And so my shape was different to my friends. And I also went to an all-girls school, which I think highlighted that because you're then comparing yourself to other girls and kind of going, well,
Hmm.
they look like this, why don't I look like that? And I think you kind of then start wanting to shift your kind of like body image towards that. And I think as well, not wanting to give my age away, but I grew up in like the kind of late 80s, early 90s, where like the heroin chic look was in fashion. So you're looking at people kind of going, I want to look like that. And my body shape was never going to look like that. But at the point of time then, I was always thinking, well, maybe I can. And maybe I can, like maybe I can get there. And so you spend all your time like looking at, well, how can I reduce my calories and how can I do this, that, the other? And I think for me, the most pivotal moment was between GCSEs and A levels. So you're talking like
Hmm.
16 to the summer before starting A levels. I actually went on my first 800 calorie milkshake diet
Right.
because it was something that was going around. I grew up in Jersey, and it was something that lots of people were trying. It was called Lipotrim, and it was very much this. You got these sachets of powder that you added water to, and that's all you consumed for however long you were on it for. So I remember that summer thinking, I'm going to give this a go because I was going to be wearing suits in sixth form, and it was all about like let's see if I can get in a smaller suit, etc. So that summer I went from being about a size 14 down to about a size 10. So
Oh,
started
wow.
A levels being, a size 10. So again, I was not living with overweight or obesity at this point, really. I was just literally
Hmm.
living, but I just wanted to look different. So that's where I started yo-yo dieting, fundamentally, when we look back and we can see, because I started A levels as a size 10. Then I went off to university. So at the age of 18, so a couple of years later. And then by the time I left university, I was a size 20. So during that, I suppose, 6 years of kind of, starting that yo-yo diet, well, the low calorie diet, and then leaving university, well, we all know everyone puts on weight at university because they eat the wrong things, they're drinking too much
Hmm.
alcohol, all of that kind of stuff. It's normal.
Yeah.
But to have literally gone from like a size 10, 12 to a size 20 is quite a significant shift there. And
Yes.
also very evident that clearly, my body was capable of obviously putting on a lot more weight than other people's. So then I spent my 20s, I guess,
Mm.
just trying to lose weight. So trying to do every possible diet that there was. So Slimming World, Weight Watchers, Atkins diet, Joe Wicks
Mm.
when it came out, Cambridge diet, so more of the milkshake diets, going to the gym, doing fitness programs. I remember doing like Rosemary Connolly and all sorts of things, like even fitness DVDs at home.
Mm.
And I would always lose a bit of weight, but it would always come back on again.
Yeah.
And I used to think it was because I just hadn't found the right thing for me. You know, I was always thinking, oh, I just need to find the right thing that's going to work, the kind of golden bullet, I suppose. So I was kind of constantly keeping going. And then literally just before the year before my 30th birthday, I was given the opportunity to take part in a weight loss TV show. So I was
Mm.
kind of like, well, like, what have I got to lose, really, other than weight? Like, let's give it a
Right.
go, because I was never shy about being on TV. I kind of, the
Mm.
idea kind of, I was like, inspired me, really. I was thinking this could be a good
Mm.
opportunity. So I took part in this weight loss TV show. So I was given a personal trainer for 2 hours a day, every day.
Wow.
And I was filmed over a 9-month period. My diet was changed. So I was on a very high protein, low carb diet. And I went from doing very little exercise to completing an Olympic distance triathlon at the end of the program,
Wow.
which which was,
That's amazing.
yeah, it was. I was just amazed that my body was capable of doing that, because I think as someone living in a larger body, you don't think you can. You think you're kind of told that you can't do things, so you kind of believe that. And I think what the main thing I will take away from the weight loss program was that it showed me what I am capable of, and actually you can do anything you want to if you put your mind to it. Kind of scenario, especially with physical activity like that. It's very much mindset is the key. And I was not
Mm.
going to fail at this. So it was kind of like that was my driver. And I lost 8.5 stone during that period as well. So I thought, this is it. I've kind of cracked it. I'm going to skip off
Yeah.
into the sunset as a skinnier, healthier version of myself. And this is it now, you know. So I continued training. I used to do more triathlons, used to run 5 and 10K, you know, really kept up that bit of the exercise, because I enjoyed it, and I enjoyed what my body was capable of. But interestingly, over the next few years, despite kind of still training, etc., my weight started coming back on. And I was like,
Right.
right, what is going on here? Because I'm doing everything that everyone tells me to do. You know, I'm eating less, I'm moving more. So why am I gaining weight? And I'm a scientist by background. So when I went to university, that's what I did. I did chemistry. And so I want to understand why things happen. And
Mm.
so I was like, I'm not going to accept that this is a moral failing of me. Like, there is more going on here,
Yes.
I'm sure. Like, I need to understand. And so that's when I started digging into the science around obesity for the first time. And I think the most pivotal moment for me was a trial by Dr. Kevin Hall. He's a doctor in the US, and he wrote about metabolic adaptation and set point theory. And it was off the back of looking at the people that had been on The Biggest Loser. So he'd like looked at them after the show and then 6 years later. So similar to me being on this kind of like, you know, weight loss program. And what he saw was everyone had regained their weight. And he
Mm.
talked about why that had happened, and it was metabolic adaptation. So this is where your body fights to get back to the heaviest weight that it's been. And it does it in a way that's like creates physiological triggers. Like, so it's making you crave certain foods, or it'll make you feel cold, so you eat to get warm, or it kind of changes everything that you do in a way that you can't control. And when I learned this, it was like a light bulb just went off, and I was like,
Mm.
so this isn't my fault. Like, this isn't me failing. This is kind of
Yeah.
me having to work with a body that's wanting me to do something a certain way. Actually, so instead of kind of fighting against my body, which I'd spent my whole life doing, I was like, I need to work out how I work with my body to be the healthiest version of me, because clearly it's going to be a challenge, but let's see how we can do that. And learning that was like also this whole like, I need more people to know this, because we're not
Mm.
talking about this. Like, people are blaming and shaming themselves, and yet the majority of them, it is not their fault. So why are we doing this? And so that's where I started doing my advocacy work more, and just really trying to shift the conversation and get people to understand the complexities of obesity, really. So yeah, in a nutshell, that's why we're here today.
Wow. Wow. That was quite an experience, actually, going through all the peaks and the troughs and going through
Hmm.
those challenging moments. I think that's quite a journey that you've had, Sarah.
Yeah.
And I think you were right. I think many of us grew up with a very simple narrative around obesity: eat less, move more. And it sounds logical, it sounds intuitive. But the more you start reading the science, the more you listen to people living with obesity, the more you realize that the story is far more complex than that. And
Hmm.
in some way, that simple narrative may actually have caused a lot of harm. And so, my question, Sarah, is how damaging has the oversimplification of obesity been? Not just socially, but clinically.
Mm. The simple answer is very.
Yeah.
Because I think, from my own, going through my journey and regaining the weight after the show, like I went to a really dark place psychologically there as well,
Hmm.
because I was very much in the space of like, how can I fail at this as well?
Yeah.
How am I like, why does my body not work properly? And if this is my life, do I really want this? Because it's such a challenge every day to kind of
Yeah.
get up, look in the mirror, hate what you see, go to work, do your it's like it's really hard. And I think what we don't think about enough around obesity is that we talk about, living in a larger body and the health implications of that, but we don't talk about the mental health implications of that, and the fact
Mm.
that I literally do not like the way that I look and have not liked the way I look my whole life. And having a low self-esteem is really hard. Like, because although and everyone kind of goes, how have you got a low self-esteem, Sarah? Like you're so confident and you're so kind of, so I said, yeah, but confidence and self-esteem are very different things. So yes, I
Mm.
can be confident about the fact I can talk about obesity and the science and what I know as a profession and like how I come across. I'm happy to talk about that because I'm confident about what I'm talking about. I'm passionate about it. But when it comes to me as a person, because I've felt like I don't belong in society and that the way that I look makes people treat me differently. And I've seen evidence of this and experienced it. It does make you kind of go, I don't like this. I don't like who I am.
Mm.
And that's a really sad thing to say and admit, but it is true. And it's a hard thing to get through every day. So like literally getting up, putting clothes on, getting out the house, kind of knowing that every room that you walk in, people are going to judge you before you've even opened
Yeah.
your mouth. Even just walking down the street, kind of it's a hard thing to kind of have to kind of constantly be processing in your brain. And I think it makes us very resilient because you have to be to get through this. But it also is exhausting because you're constantly evaluating things. So just simple things like going into a room when I was, much bigger and looking at the chairs in the room and thinking, have they got arms on the chairs? Like, am I going to fit in that chair? How comfortable am I going to be sitting in that chair? Will the chair hold me? All these different things that we kind of, people not living with obesity just wouldn't even be thinking about. Yeah, it's just exhausting. So I think fundamentally what I was saying was like it's that kind of it's the level of kind of pressure that you've constantly got, knowing that you're being judged by
Mm.
like the way, because obesity is one of these things where you can't hide it. So lots of people
Yes.
will have chronic conditions and they don't need to share those or people won't know about them because it's not
Mm.
a visible one. Whereas I think with
Yes.
obesity, it's so visible that people literally look at you and go, she's clearly lazy, probably not very educated, eats too much, and makes these snap decisions around you before you've even opened your mouth.
Mm.
And I think that's a hard thing to kind of, have to deal with every day. It's a struggle. And I think more recently over the last kind of few years, I actually had a conversation with a healthcare professional because this is not just about society. It kind of goes
Mm.
across all areas of life because ultimately healthcare professionals are just people. And I always say that, they see the same media as us, they hear the same messages
Yeah.
as us. It's not going to make them any different. But yeah, I was having a meeting once, a kind of a debate on about obesity with a professor.
Mm.
And we had a great, conversation. And at the end of it, he looked at me and he just said, I've never met anyone like you, Sarah. He said, because you're like a thin person in a fat body, because you're clearly very intelligent, aren't you? And I
Oh.
literally was like taken aback by this because I could see that he was trying to give me a compliment.
Mm.
But I was like, the fact that you even think that's an okay thing to say, like, blows my mind. The fact that we're like, so you think that because I'm potentially intelligent, that I should be living in a thin body, and how could I, just that whole thing just made me go, this is where we need to stop. It's like somebody's body shape does not determine who they are as a person, how
Yeah.
intelligent they are, kind of anything. It's just a body that they live in. And it's like we don't judge people based on their height or their hair color. Or,
Exactly.
it's like we just know that people have different hair color, different eye color, different heights, different skin color, different, I know we've had to work harder with some of the things like skin color, for instance, and things to get to a point where the stigma is removing. But with obesity, it's still very much there that we make these absolute judgments. And that's really tough to kind of actually know that that's happening all the time. So, yeah.
Yeah, it is indeed very true. And I remember speaking to a friend of mine who told me once that they avoided going to the doctor for years, not because they didn't care about their health, but because every visit eventually turned into a conversation about their weight.
Yeah.
And that really stuck with me because when people feel judged in healthcare settings, they often stop seeking help altogether
Yeah.
or care altogether.
Where I hear this all the time, because I talk to
Yeah.
people living with obesity a lot, and that is one of the things why I like do what I do, because that's absolutely not okay. And I've heard, stories of people that haven't presented with a lump or in their breast for potentially, and then therefore when they have actually ended up going for care, it's like it's too stage 4, and if they'd have gone
Oh my
earlier,
God.
we wouldn't be there. And I just kind of go, everyone should be given the same levels of respect, care, treatment, that no matter what shape or size you are. Like, we shouldn't
Yeah.
make this judgment, and we shouldn't treat people differently. But it does happen, and I saw it across my own journey of when I was trying to get pregnant when in my mid-30s, where I was struggling. I'd been trying for a couple of years. Another one of my friends was going through the same process. She had been struggling for a couple of years. We were the same age. She lived in a normal body size. I
Mhm.
lived with obesity. We both decided to go and speak to our GP about, is there anything we can do? Is there any tests that we need? Should we be exploring things? She was offered a plethora of fertility treatments and options, and I was just told to lose weight. And it was like so obvious we were treated very differently based on purely our bodies. And that again was like just really highlighted that like this needs to change, and we need to look at things very differently.
Right. And Sarah, one thing I find fascinating about people who become advocates is that very few of them start their journey thinking, I'm going to be an advocate one day. Usually something happens. Sometimes it's frustration, sometimes it's a moment of realization, and sometimes it's seeing the same problem repeat itself
Hmm.
again and again. And you feel you have to do something about it. So I'm curious about that moment for you. When did obesity become something happening to you, or stop becoming something happening to you and start becoming something you wanted to understand, challenge, and change?
Yeah, it's a good question. And I think for me it was after the TV program for me.
Mm,
It kind of highlighted, I suddenly was like, why do people care about my journey? Like, people kept asking me, come and talk about it, share your experiences and things. And I was kind of thinking, well, why is this so interesting to people, to see? And I think it's because transformationally, people love this before and after kind of, they love
yes.
seeing, it's like, oh, great, she looks great now. But for me, it was like, well, that's not why. I didn't do this to look great. I did it to improve my
Mm,
health and to get to a point where I wasn't living in with so much, adipose tissue, etc. But so the advocacy bit for me was like, I suddenly realized that lots of people were listening to me all of a sudden and kind of wanting me to talk about my experiences. And I think, I'd spent up until that point, I suppose fighting against my body and kind of looking at it in quite a negative way. And my obesity, I wished I didn't live with obesity. So to talk about it, and it wouldn't be a conversation I'd want to have. But I suddenly kind of had this moment where I thought, I've got an opportunity here to really start shifting people's mindsets and thoughts and to get them to understand obesity. So why don't I use this in a positive way and use all my experiences of living with obesity up to now to start changing that and having that opportunity? And so I kind of felt like it was my kind of, I suppose, I don't know, role, and the fact I've been given this like privileged position to do this, that I couldn't
mm,
not do that, because I wanted other people living with obesity to not feel the shame and blame and kind of all this negativity around obesity. I wanted them to know this wasn't their fault. And so that's kind of the moment where I was like, yeah, I need to do this. And then it's just kind of snowballed from there, really. I think the fact that I am a scientist as well and can understand
uh,
the science, and the fact that I've worked with the pharmaceutical industry for a number of years and the NHS for a number of years through my career, it kind of gives me this 360 approach, because I've not only just, got the lived experience, but I know what the environment looks like, what the systems look like, and how we can kind of shape and change those. And I think that's kind of allowed me to get into the position that I have, because I kind of bring all those unique insights, I suppose, that not many people could do. And now it's just like, I am so privileged to be able to do this, because it's such a passion of mine now to make sure that we can shift the conversation around obesity and we can start making a change. And I don't feel like I'm working. I feel like I'm just kind of, making changes and being positive and doing all the things I'd want to do. And it's like, it's great that I can now call this my job, as well as that. So, that's where it all started for me. I think it was that shift from having this platform all of a sudden and knowing I could utilize it in a positive way.
Right. And Sarah, you have successfully bridged lived experience with science, policy, and system thinking, something many organizations struggle to do.
hmm
So, what enabled that transition?
I think fundamentally because of, as I say, like my qualifications and my training.
Mm,
So, being a scientist, so understanding how the body works, how drugs work, why drugs are needed for certain things, and how the interplay with all of that. And then around kind of understanding the NHS and how they work, how the NHS works, because I think a lot of people don't understand how the NHS works. So
yeah.
understanding the process behind integrated care systems and integrated care boards and the local community, and also the councils and how they fit in and how all the different systems all interplay together. And then I've been involved with the all-party parliamentary group for obesity for a number of years now. So learning kind of what goes on at number 10 and what goes on in those conversations in Parliament and what does that look like, and being able to sit and shape some of those conversations has been really insightful as well. And then even just like being part of media conversations. So,
Mm,
shaping the societal message, which I think is so key, has
yes.
been such a privilege to be able to help shape some of that as well, because I think it's really important. And then it's around kind of sitting on. So I've also been privileged to sit on NICE. So obviously
Oh,
NICE is
wow.
the drug regulatory, which I know lots of your listeners will know. But so I've been involved in most of the technology appraisals for the obesity medications coming through. So that's been really interesting, because it's given me an insight from another angle again around kind of what are we
Mm,
looking at to make sure these drugs are fit for purpose, should be available for people, and then looking at kind of things around then the implementation of these drugs now that they're coming to market and what that looks like, and seeing all the blockers and the frustrations and the fact that it's not a simple process of NICE just saying yes and suddenly patients being able to access medication. And then also just the process around just people understanding kind of why they need care and
mm,
support, because I think the stigma is so internalized in people living with obesity, because we have been told our whole lives this is our fault. To suddenly be told, actually, there's some care and support for you and you don't have to do this on your own, is a big thing for somebody to accept, because they've been so kind of not used to that. And so getting people to acknowledge and understand that they do deserve care and treatment, and they do have potentially a chronic condition here, and this is something we do need to manage with them, and this isn't their fault, is a lot for people to take in and accept. So that's been a big piece of work as well, as around just trying to soften that and to get people to understand um, obesity and the fact that
right.
it's hugely complex.
Yeah. And Sarah, did you face any resistance when bringing lived experience into traditionally clinical or policy driven spaces?
I think I've been quite fortunate that not massively. I haven't
Mm,
felt resistance, but then I don't know if it's because the way that I do advocate and the way that I kind of work is that I don't just go in and shout and scream and rant and say, you're doing something wrong.
yeah.
I go in and say, right, this isn't quite working. Have you thought about doing it this way? Or
Mm,
this is another way of potentially looking at it. So I think because I'm quite a solution focused person and try to
mm,
see how I can work with somebody or a system or to change it rather than tell them they're just doing something wrong and be like, that's it. Which I think when you look at other areas of advocacy, sometimes it can be quite like, this like you've shamed us, blamed us, you're doing something wrong, you need to do something different. And then there's none of this kind of like co-production going on, or there's none of this how can we do this together going on. That's what I've tried to bring into this space. And I think that's what kind of made me successful, I suppose, in it, because people are listening and they're not kind of going, oh gosh, please don't invite her back to that meeting. Like we don't, she all she does is kind of rant and rave. They kind of go, actually, she's adding value. and we
Mm,
should be listening, and she's making some fair points. And I think that's where, yeah, I think I've managed to hopefully get quite a nice kind of dynamic there. And that's why people are potentially listening to what I say.
right. And did you ever feel the pressure to, let's say, professionalize your story or dilute it to be taken seriously?
No, I think again, I've always been I'm very open, and I'm literally like, ask me anything, because I think there's no point pretending it's not as bad as it is, or making it worse than it is, or kind of holding back. Like, I'm very open about sharing all of my life story, because I just think it's a part of who I am, and if it can make a difference to changing the life or improve the life of somebody else's, then I'm all for it. I just think it's important. So no, I haven't. I've always, I suppose, been authentic in my story and kept it real, because it's like, if you don't like it, it's like
Mm,
that's the reality, unfortunately. And that's what we need to look at, is that, yeah, you might not like my story or hearing what's been through. So let's make a difference and make sure other people don't have to go through that. And I think that's kind of, yeah, how I've always addressed it, really.
right. And Sarah, what personal values have anchored you when navigating these spaces?
Just always trying to think about, what's the bigger picture here, I suppose. So I think
Mm,
I've always kind of thought that by me attending this meeting and sharing this, or my experience, or kind of trying to make a change, what's the outcome or the potential outcome from me doing that? And I think it's always
right.
like, if we can shift the way just one person thinks in that room differently, and that they can then advocate within their system to do something differently, then that's a step in the right direction. So I think
Yes.
for me, it's always about just thinking about the bigger picture, and kind of what the output of that actual thing that I'm doing. Even though I remember the first time being asked to go to Parliament to speak, kind of being on the train, kind of going down thinking, why on earth do they want to see, to hear me, using the derogatory word fat, but kind of a fat girl coming to Parliament to talk about her story. Like, why does anyone care? Like, what difference am I going to make? And I just remember really thinking that. And then now looking back going, I now know, like, what difference I can make, and why it's important, and why that value of sharing stories is really important. But it's just interesting that I think we sometimes really do put ourselves down, and kind of don't value the importance of our voices, and the importance of, like you said at the beginning, the lived experience, and how that can really help move things in a different direction. So yeah, there's definitely been a huge shift in my thinking around the importance of what I say, and the value that I bring. And I think it's about just encouraging other people to feel that they have lots of value to bring in what they're saying, and that they should share it.
Right. I think you made a fantastic point there. And that's one trend that I find really encouraging in healthcare today is the growing recognition that patients should not just be the recipient of care, they should be partners in shaping it.
Yeah.
But historically, healthcare systems haven't always been designed that way. In many cases, decisions about patients have been made without patients in the room. And that slowly starting to change. And you have championed lived experience as a legitimate input into policy guidelines and
Mhm.
system design. What changes when voice is truly integrated?
I mean, we're still working on it. I wouldn't say
Yeah.
we're there yet. Like, it's definitely a work in progress. But just simple things, like even just getting language changed and the way
Mm,
people are talking. So, we used to call people obese, 10 years
yes.
ago. That would be something we would describe someone as, would be like, their BMI is whatever, over 30, so therefore they are now obese. Now, we are trying hard not to use that word now, because using the word obese is the same as using the word cancerous, for instance. And we would
Mm,
never say to someone living with cancer, oh, that person's cancerous. We just wouldn't even dare use that word.
yeah.
So we're trying to move away from the word obese, because basically you're labeling someone as their condition, rather than actually saying that they're living with a condition. So we say living with obesity, or living with overweight and obesity. And so that can just make such a difference in how a narrative lands, or how someone feels about that conversation. Now, we know the word obesity still carries a lot of, well, kind of stigma on itself. Like, some people hate the word obesity, but I always challenge that and say, we don't hate the word diabetes or asthma or
Mm,
cardiovascular disease. Like, we know that they're a medical term for a clinical condition. So why do we give obesity so much power? Like, why are we giving that word so much power? Because
yeah.
ultimately it's just a clinical term for a medical condition. And I think it's about just kind of really reframing that sometimes, because, it's a word that's been used, I suppose, so badly, and to kind of shame and blame people that's why they're veering away from it. But actually, it is just a clinical term. That's all
Yeah.
it is. So let's not give it any more power than that. And then let's just, work with managing someone's health alongside it.
As I said, we are currently at a really interesting moment in obesity care. There's a lot of scientific progress happening, new treatments, new research, much deeper understanding of metabolism and biology. But I believe that innovation also raises important questions because breakthroughs in science don't automatically translate into equitable access and compassionate care. And the gap between discovery and real world impact is something many healthcare systems still struggle with. So, we are seeing rapid innovation in obesity therapeutics and care models. What excites you, Sarah? And what concerns you?
So I think what excites me is, for the first time ever, that I'm suddenly thinking there are treatments and support available for people living with obesity. Because I've spent most of my life going to see my doctor saying, please, can you help me? I don't know how to kind of lose weight. I can't maintain my weight loss. I really want to sort my health out. What can I do? And I've been met with, well, you seem to be doing all the things you should be doing. You're exercising, you're eating well. There's not a lot we can do. And having like doors
Mm,
shut in faces and just not, having any sort of kind of support really, to now, knowing that everyone is talking about obesity, whether it's in the right way, I do question sometimes, but now these medications are available, and I say available loosely because we will talk about that frustration in a minute.
yeah.
Now that we have, new treatments coming through, a pipeline of 174 medications in the next 10 years or something coming through from the
Wow.
pharmaceutical industry, I think it's exciting and gives me hope. It gives me hope that I'll be able to manage my health in a way that I've never been able to do that, and not only lose weight, but maintain that weight loss for the first time as well. Because for me, obesity treatment and care isn't about weight loss. It's about maintaining health benefits for people living with obesity long term. And we've not been able to do that. And I think that's what I'm excited about these new medications doing and bringing, and the shift in the way that we, look at obesity and how we support it and we care about people. That's what's important. I think the frustration for me is around, because obesity is so visual, there's this whole thing around weight is such a thing that anybody,
Mm,
no matter if you're, a size 0 or a size 30, like people are obsessed with body shape and size. And what we're seeing with these new medications, being available, and because the private market is making it so accessible, is that people that don't need these medications are accessing them. And that concerns me. And I think one of the things that I say on a pretty much daily basis is these are prescription only medicines. These are not aesthetic medicines. These are not lifestyle medicines. These are prescription only medicines for a chronic condition. Like, why would you take this? If you didn't have diabetes, would you take insulin? No.
mm,
If you didn't have asthma, why would you take an inhaler? Like, so why are you taking a prescription only medicine for a condition you don't have? Just because you're trying to get in a dress for a wedding or a going on holiday and looking better. It's kind of like, it's so bad that we are so image conscious in this world that that's what people are willing to do, that they're willing to put a medication in their body that they don't need purely for aesthetic reasons. And that concerns me. And then the other thing that concerns me is the access to these medications for people that
mm.
need them. Because what we're seeing is, because 2/3 of the population are living in the UK with overweight and obesity, the NHS and the policymakers are going, well, we just can't afford to be putting everybody on these medications. So we're going to put all these hurdles in the way to enable, to stop people from being able to access them. And so we've seen this with, NICE approving the medications because they see them as cost effective, they see them as safe, and they see them as a true valuable treatment for people. And then when it comes to NHS implementation, the NHS England are kind of saying, well, hang on a minute, we can't just open up the doors to everybody meeting the prescribing criteria for these, because we haven't got pathways in place. We don't have capacity. We don't have enough staff. We don't have structure for this. And we can't afford it because we're not being given any additional funds to then fund these medications. So these are becoming then huge blockers that patients can't access these medications.
Yeah.
And that is really frustrating, because then you see the media going, brilliant, these wonder drugs, there's this, that, and the other, and everyone going, great, I want this wonder drug, but then you can't get access, unless there's a service in your area, or unless you meet certain criteria, which they're making harder and harder. You're really up against all these blockers. So, as someone that's lived with, a whole life of having to jump over hurdles to get anywhere, it's kind of, that's not getting any better. So I am concerned that, we could have all the drugs in the world available, but if we can't access them, it's kind of irrelevant. So we really do need to look at the access piece and not just make it that if you can afford it, you can get it, because that's what's happening right now, isn't because we're going to create a two-tier health system where those that can afford health can have it and those that can't. And I think that's not okay. That's not why the NHS was set up, and B, that's not fair on society. It's like, just because you can't afford a medication should not mean you can't access it. So those are my two, I suppose, big frustrations around that, is that it's exciting. It's amazing that we're seeing all these scientific advancements, and that the future will be amazing for people living with obesity. It will change the way that we manage our weight. It will change the way that we manage our health in the future. But we can't leave people behind. And I think World Obesity Day happened recently, and one of the campaigns with World Obesity Federation was around, if we don't do something, we will be leaving half the world behind. And I think that's pretty, thinking about that on a scale, that's not okay. Like, why would we want to do that? So we do need to really shift the way that we are doing policy. We are, allowing the NHS to function and kind of all of those things, and look at how we can improve that for people, for sure.
Right. And you've raised such an important point about obesity and its perception, because it can get subjective to a certain extent.
Yeah.
Different people have different definitions of obesity. And so, someone who doesn't have any medical background, how would you technically and non technically define obesity?
So technically, somebody living with obesity is someone who has a BMI of 30 and above, which is 30, BMI 30 is not that high.
Mm.
And then, so people kind of go, yeah, but then what happens if I've just got a lot of muscle mass? So we know, like, for instance, rugby players can be deemed as living with
Yes.
obesity because their BMI is over 40. So I think a way of then kind of clarifying it a little bit more is to say you've got a BMI over 30 and your excess weight is impairing your health. So you might be then, I don't know, even joint pain, or you've got high blood pressure, or just anything that is a way that your health is being impaired by that excess adipose tissue, which is your fat tissue, being in your body. That's where we would say that you are living with obesity. And I think the thing that automatically people think is, well, you just need to lose that weight. But the problem is that the diet industry is so geared up to kind of get people to be on this diet cycle of losing weight and putting it back on again. That's why they make so much money. So what we know is it's not really about the weight loss. It's about the health gains and the health improvements that we can make. Because going back to metabolic adaptation, when you lose a lot of weight, your body will fight for you to get that weight back on. So it's about managing that. And I think the other thing that we don't talk about enough is that obesity is an outcome, not a behavior. And we talk about things like comparing it to smoking or alcohol, or their behaviors. They're not outcomes. And managing it with lifestyle changes or behavioral modifications. Weight, and we think about it as being, or a lot of people think it's a behavior, and they just say, well, if you make lifestyle changes or behavior changes, you can basically behavior change your way out of this. And I kind of go, no, we know now that you can't just behavior change your way out of obesity. It's not about just making choices. And I think I work very closely with Professor Giles Yeo at Cambridge University. He's a geneticist, and he always says obesity is not a choice, because your genetics have given you, played such a part in it. And then people will always challenge back and say, but you are choosing what you eat, and you are choosing how much movement you make, and you are choosing all these things. But the point is, but why are we choosing them? And I think that's the bit that people don't understand, is that I'm not getting up every day going, do you know what? I'm just going to eat loads of ultra processed foods today. I'm not going to move much, and I'm just going to, do whatever. Like, there are so many things that influence and affect those choices that we make. And when your genetics are such a big part of that as well, you're up against biology fighting those conversations and those things as well. So it's not just as simple as just being, oh, this is just me and I'm making better choices than somebody else. And we see that a lot, is that there's this elitist atmosphere around people that live in smaller bodies kind of going, well, I just make better choices and I'm just doing this. And it's like, well, actually, no, you're not. You've actually been dealt a different genetic makeup to me. And then you might be making choices, but that's because it's easier for you to, because you don't live with obesity.
Yeah.
And I think it's about just getting people to acknowledge some of that, because I do get challenged on this all the time, that they're kind of like, no, but Sarah, I know people that, they do just eat rubbish and they do just do this. And it's like, yeah, but why do they? Why do they?
Mm.
Have we thought about why? And I think there's a huge part around trauma and kind of things that have happened in people's past, which again, everybody will have something traumatic happen to them at some point during their lives. And it might be a small thing or it might be a much bigger thing. And how that affects people again can be very different. And again, it can come down to, your biology and how that affects you. But what we need to realize is that these things do impact somebody and how they then live their life. And it's not about shaming them for that. It's about seeing how we can help them, support them. And I think this is where, coming back to how complex obesity is, it's not just about food. It's not just
Mm.
about what we eat. It's not about how much we move. It's about the environment that we live in. It's about, the levels of the families we've been born into, the areas of the country that we live in. Like, all of these things play such a big part in kind of our lives and how it shapes us. And so many of them are things that we don't choose which family we're born into, and we don't choose where we live when we're children, because it's just where you are living. And it's kind of all these cards that I think that we need to really acknowledge, that there's a lot of things here that aren't people's choices. And so we need to stop
Yes.
thinking that obesity is a choice, because it's not.
Yeah, absolutely. And we were talking about access to the medical innovation and the new medicines that are coming in. So, how easy or difficult it is to get a prescription for the innovative medication in the NHS? Because I've heard it's really hard to get a prescription, even to people who genuinely need this treatment.
Yeah, it's really difficult. So when the first innovative incretin therapy got its access through the NHS, so through NICE, I knew the date that this was happening, and I was like, right, I'm going to go to the GP because I meet all the criteria for this. I'm going to see if I can get access to it. And I was just met with no as a response, because they were like, there's no additional funding for these medications. They had to be delivered within a specialist weight management service. The medications that came out, there is no specialist weight management service in the area that I live. And so it's kind of, you're met straight away with, there you go, there's your biggest barrier. You've got no weight management service, so therefore you can't get access to the medication. Now, there's a newer molecule that's come to market that can now be used within primary care. So you'd think, great, the access will be better. But again,
Mm.
no, the access is not better, because alongside the medication, people need to have kind of care and support around it. So seeing, a doctor, seeing a dietitian, seeing a physio, potentially seeing a psychologist, those services don't exist in lots of areas. So people are then saying, well, we can't prescribe the medication because we can't support with the wraparound care that's needed for the medications. So therefore, we're just not going to prescribe them. So then you're met with that situation. So getting it on the NHS is really hard, because you've also then got criteria that NHS England have now set in around having a BMI threshold of over 40 for some of the medications, plus additional comorbidities. So what we mean by that is like high blood pressure, cholesterol,
Mm.
sleep apnea, those kind of things. So you have to tick all these boxes to even be in a position where they say, okay, yeah, you meet the criteria. Then it's a case of, well, will someone then prescribe it then? And it's not always yes then either, because if they can't support you properly, etc. So it's hugely frustrating. You are literally being met with so many blockers along the way.
Right.
So that's why people are accessing the medications through the private market, because for some bizarre reason, which again, I still don't fully understand how we are suddenly able to get prescription-only medicines through the private market, people are accessing them that way. And so I think we know that 95% of the prescriptions for these medications in the UK are through the private market. Which is crazy to think only 5% are getting access through the NHS.
And in your opinion, what role pharmaceutical companies are playing in this whole situation? Not just in treatment, but in education or challenging the stigma or the system reform.
Yeah, I mean, I've worked closely with a number of the pharmaceutical companies over the years, because I think, they value the lived experience and the patient voice, and they want to ensure that what they're doing is correct and is going to land properly, and, are they getting the language right? And so we know that there have been campaigns, and that, stigma is always a big focus for them. They're always trying to say, well, how can we change the stigma, and how can we get people to recognize obesity as a chronic condition or a disease or whatever it is that they're trying to say. But I think the problem with the pharmaceutical industry is that of people have a lot of skepticism around them, around their morals, around what they're trying to do, which I think is a challenge, because ultimately, we don't get the same level of scrutiny for other therapy areas. So, when, for instance, if we think about cancer, and I keep coming back to cancer and people go, how can you compare the two? Well, actually, the social determinants around cancer and obesity are very similar. So there's a lot of similarities, actually. And actually, we know that if there was a new chemotherapy drug available, and we've seen it, people will fight to the death to try and get that medication through the NHS and get it back. You're not seeing that with obesity because people, A, don't think they deserve it. People think that, these things aren't something we should be doing. We should just be eating less and moving more. There's this whole different narrative going on. And I think it is about, how can we kind of get everything on an even playing field and allow these medications to be as accessible as some of the other therapy areas when new innovation comes forward. We're normally excited by it, not challenged by it. And I think the other thing that you find is that you're then hearing people say, but they're just cheating because why are we giving them medication when they can just eat less and move more? And again, it's because they don't understand the complexity. So I think pharma are trying, but they just don't get the same traction as, I suppose, people living with obesity talking about it. Even I get a challenge on this, telling me that I'm just talking rubbish and that I'm coming up with excuses and that it's just me just trying to justify the fact that I live in a larger body and all of these kind of things. But what I always go back to is you can't fight the science and the data and the evidence fundamentally.
Yeah.
And also, if it was as simple as we have been trying to say for years, why are 2/3 of the population living with overweight and obesity? Are you basically saying that we're all not very intelligent and we're all making really bad choices and it's just literally our choice? And the reality is that it's absolutely not, because if it was, I think if it was that simple, people would not be living with obesity because nobody chooses to. Like, nobody wants to live in a life of restriction and of pain and of kind of being, looked at in a certain way. It's like, I would do anything to live in a smaller body for that reason. So I think we just need to shift that. But pharma do find it hard because they've kind of got that initial, again, they've got their own stigma, I suppose, around the pharmaceutical industry to overcome. But they are trying, and they're trying to see how they can support and change and in a positive way. But I think it's around, I think we've got to start with the societal overall messaging of, if we accept that obesity is a chronic long-term condition, we need to then support people and care for people and have more empathy rather than challenging, blaming and shaming, which is what we're doing at the moment.
Exactly. And Sarah, if we were to fast forward, let's say 10 years, what would good obesity care look like, both structurally and culturally?
Big question. I think for me, it would be around the access piece. So I would think that I would hope that we will hopefully have more tools in our toolbox, which I think is important because, obesity care is not about a one size fits all. We need to have options for people, whether that's just from, dietary interventions all the way up to bariatric surgery. Like, I do still think there'll always be a place for all of these things. So I would like to see, a big toolbox, much fuller than it is right now. And then I'd like to see that we don't have all these barriers that we have to get through. So I'd like to see that there are pathways in place, that people are very clear around, if they want support and care for their chronic condition, that they get it, and that we start treating obesity as a chronic condition, because at the moment, a lot of the things that are starting to come through are acute solutions for a chronic condition. So for me, that's like a waste of money and time, because all you're doing is just creating something that someone's going to fail at. It's not going to work. So why do we keep investing money into these things? So I would like to see that there's, much better, much more chronic solutions for people to support them, and that this whole wraparound care piece around access to psychologists and dietitians and physios, and that the fitness industry embraces this in a different way as well. Because I think I do some work with the fitness industry at the moment, and there's still this kind of hesitance around, these medications are going to take patients or people away from us. And I'm like, absolutely not. Like, what it's going to do is mean that more and more people will want to be moving more and will need support around how to build up their strength. And this is a positive thing. So let's embrace it. Make your facilities feel more inclusive for people, because the gym is the place I probably feel like I belong the least. So it's like, make that a place I want to come and go to, and then, encourage that rather than kind of make it this elite environment where you go and everyone's walking around, looking like something out of a fitness magazine. It's like, that is not a space I want to be in. So there's lots of things we can do to shift the environment, the way we feel and look, etc. And I think that we need to be looking at that. So that's what I'd like to see, is that everything's a bit more inclusive. We have more empathy and understanding, and we have more access to care and support, because, then that would be a much nicer place to live.
Exactly. And Sarah, before we wrap up, I always like to come back to the human side of the conversations.
Yep.
And because behind every leader, every advocate, or every founder, there's a person navigating their own journey and their own challenges,
Hmm.
doubts, and motivations. And I think that's often where the most meaningful lessons live. So, what has the journey taught you about resilience and identity?
I think the journey for me has taught me that I need to be much kinder to myself because I
Yeah.
think, I've not been very nice to myself. I need to learn to work on my self-love and like, love myself a little bit. And as cheesy as that sounds, I think we all need to love ourselves because if we don't love ourselves, how can we expect other people to love ourselves and respect us? So I think that's been a big learning curve for me is that piece. And also just focusing around just knowing that your body shape is like the least important or exciting thing about you. You're still a person.
Mm,
You add lots of value and bring lots of amazing things, and that we shouldn't just look at ourselves as being this vessel that houses us. We should see ourselves as being much more than that. And I hope that society will start seeing us as much more than that as well. So that's my kind of focus and where I think I would hope that we can start shifting that to stop being so visual and start actually seeing people as the incredible individuals that they are. And I think that, it'd be a much better place if we could do that.
very well said. And Sarah, how do you personally sustain yourself while doing emotionally demanding work?
It's a good question. Don't know if I do it brilliantly well at times. So I haven't mentioned actually on this, but so I am on some of the weight loss medications now, and I do have to kind of consciously say to myself sometimes, are you eating well here? Like, because you don't want to eat. So, that whole kind of idea of feeling hungry goes away. So you literally have to
Mm,
be like, I sometimes have to question whether I've eaten today. I'll kind of go, have I eaten today? And then need to be really conscious about when I do eat, am I getting the right fuel for my body? So am I kind
yeah.
of giving myself the right nutrients? Because again, it's like, because I've spent most of my life telling myself I can't eat this, I can't do this, I can't. It's kind of like to be in a space where actually all of a sudden you're then going, I need to make sure that what I'm putting in my body is nutritionally great. It's not about
Mm,
restricting me anymore. It's about making sure my body can function properly. And I'm not great at that. So that's one of the things I'm trying to get better at, is kind of, I suppose, just kind of nurturing myself because I am very good at putting other people in front of myself. And I think that comes from, having low self-esteem and kind of spending your life doing that. You kind of value everyone else around you rather than yourself. So I'm trying to get better at valuing myself. And so that's can be a challenge, because you kind of I'm so busy and I don't want to say no to things. I want to support everything that I possibly can. But I think sometimes I need to just be mindful that, I there are only 24 hours in a day and I do have a small child as well. And so trying to manage all of that, it can be interesting. So I think it's just kind of taking some time to just step back and making sure you are kind of nurturing yourself and resting and, doing a bit of self-care, because I think we can all be better at that. So that's what I'm trying to consciously be better at, I guess.
right. And Sarah, if you could speak to someone living with obesity who
Yeah.
feels unseen or blamed, what would you like to tell them?
I think fundamentally, so if you are living with obesity and you're feeling all those negative things around, this is your fault, you're blaming and shaming yourself, please don't. And please do, I suppose, just recognize that obesity is not your fault. This has been lots of things coming into play here: where you live, the environment we live in, the messaging that we've been told, the fact we haven't had care and support, the diet industry kind of corrupting us over all these years, telling us we should be doing this, that, and the other. Like, it absolutely isn't your fault, and that actually you deserve all the care and treatment and support that you want and need, and that it's there for you. And please don't feel alone. There are lots of people living with obesity in this space, and absolutely will be there as to kind of support you if you need it. So please don't feel like you're alone. Please do reach out and try and get some support as well, because you absolutely are a fantastic human being and you deserve the care and support that everybody does. But it's tough. And I know it's hard to hear that sometimes. And sometimes I kind of go, yeah, but that's not me. It is you. So please, this isn't, it's not a failure. Please don't feel shameful about it. Living with obesity is very complex, chronic, and a lot of the cards that you've been dealt have not been your choice. And it's about how we manage this in a way to make sure you can be the healthiest version of you. And that's what I'm trying to do every day. So yeah, you're not alone. Lots of people out there to care and support for you.
Wow, that's a brilliant piece of advice, Sarah. And
Thank you.
that also brings us to the end of our today's episode. So thank you so much for taking the time to join me today. I've really, really enjoyed this conversation.
No, thank you for giving me the opportunity as well. I think that, I think the more people that can kind of listen to that human touch, like you say, and just learn those stories and hear the stories, I think it does just make people think differently, even if it's just a tiny piece that you've taken away and gone, oh, hadn't thought about that, then that's a positive thing
Yeah.
in my eyes.
Often the discussion is framed around statistics and policies or treatments that we talked about earlier. But hearing the lived experience behind it all adds a depth and perspective that's incredibly powerful. So I'm really, really grateful to you for sharing your story so openly, so honestly, with such authenticity, and for the work you continue to do to challenge stigma and help move the conversation around obesity in a much more compassionate and evidence-based direction. So
Thank you.
thank you once again for being so generous with your time and with your insights today. And it's been a real, real pleasure having you on Rat Diaries today.
Thank you so much. I've really enjoyed being here. Appreciate it.
Thank you, Sarah.